Good day, everyone. I am Josephine Ginto from BSED student, and I will be discussing about the differentiating the standard precaution and transmission-based precaution. The standard and transmission-based precautions are the cornerstone for all infection prevention activities to prevent healthcare-associated infections and the transmission of communicable diseases to patients, staff, and visitors. Now let's start on the standard precautions. The standard precautions are a group of infection prevention practices which include the hand hygiene and the use of gloves, gowns, masks, eye protection, or face shields depending on the anticipated exposure. So the basic premise of standard precautions is to treat all patients or residents' blood or body fluid as if they are infectious. So it is important to train all the staff and monitor their compliance of these precautions. So there are the key components of both standard and transmission-based precautions. First, the point of care risk assessment, which is prior to every patient or resident interaction. All healthcare providers have the responsibility to assess the infection risk posed to themselves, other healthcare providers, patients, or visitors, and the ability to perform a thorough point of care risk assessment of the patients or resident and their environment is fundamental to practicing infection control. So the IP needs to have a very complete understanding of how to do a risk assessment, how to include it in every patient or resident interaction, and how to use the finding to implement appropriate infection control practices. Next is the source control. Source control involves the measures to separate those patients or residents with symptoms of various transmissible organisms from those without. So these measures can include spatial separation, whether in separate waiting rooms or in the separate of patients by 2 meters for respiratory illnesses involving the production of aerosolized droplets, and other source control measures involving erecting partitions to protect staff, following facility-specific protocol to place patients or residents with certain symptoms or known organism directly into a single room. Next is the hand hygiene. The hand hygiene has been identified as the most effective way of preventing the transmission of healthcare-associated infection to patients, staff, visitors in all healthcare settings. Because hand hygiene represents a new term in the healthcare vocabulary, it is critical that all infection control professionals become familiar with the new terminology and the heightened emphasis placed on hand hygiene in healthcare settings. So, despite the fact that hand hygiene is considered the most important and most effective infection prevention and control measure, compliance with hand hygiene protocols by healthcare providers continues to be low. So there are the five elements of hand hygiene that are important for every healthcare provider to understand. First is the indication for hand hygiene. So in every healthcare setting, there are certain times that hand hygiene can and should be used for the best infection prevention. And these select times are also referred to as before and after moments and relate to before and after a healthcare provider will come in contact with a patient, resident, or their environment. Second is the hand hygiene technique. The correct technique is a fundamental part of hand hygiene, and there are many things to consider with regard to the correct performance of hand hygiene. And this include the duration, hand characteristics. Example of that is the nail length, types of clothing and accessories worn, and areas of the hands that are often missed. The third is the hand hygiene agents. So a multitude of agents are available for hand hygiene in any healthcare facility type, and the agent used in a particular location may depend on facility policy, price, staff acceptance, type of care performed in the settings, and etc. And the fourth is the hand hygiene policy. Every healthcare facility should have a hand hygiene policy in place. So there may be multiple policies in place that describe different aspects of hand hygiene, such as selecting the agents that will be used or who is responsible for monitoring compliance. And additionally, there may be policies for each individual location within a healthcare facility. And it is very important that the IP is familiar with all policies that relate to hand hygiene within their facility. And the last one is the hand hygiene monitoring. So as mentioned before, it is often the responsibility of the IP to monitor for compliance with hand hygiene policies and procedures. So, it is imperative for the IP to understand the audit process, why it's important, and to whom and how and when the audit results are provided. So, let's move to the patient placement. Single rooms have been shown to lower healthcare associated with infection or associated infections. When there are a limited number of single rooms available, it is prudent to prioritize them for those who have conditions that facilitate transmission of infectious material to to other persons. Example is the draining wounds, stool incontinence, and uncontained secretion. So additionally, those patients or residents whom are at an increased risk of acquisition and adverse outcomes resulting from healthcare associated infection. Example of that is the immunosuppression, open wounds, inhaling catheters. And it should be placed in single or private rooms when possible. Next is the patient flow. Patient flow refers to the transfer or transportation of patient or residents either within or outside of the facility as well as individual patient or resident movement. And it is necessary to use appropriate precautions when transporting patient or residents. And next is the aseptic techniques. Medical and laboratory procedures of any kind are performed under certain conditions and using one of two techniques, the aseptic versus clean, and an awareness and understanding of each will help the IP to distinguish between the two techniques, know when aseptic technique is required and when clean technique is acceptable. The next is the personal protective equipment. So personal protective equipment or the PPE is any type of specialized clothing, barrier product, or respiratory device used to protect the individual from potentially infectious persons, bodily fluids, and excretions or contaminated objects. And the PPE acts as a barrier between infectious material and the skin, mouth, nose, or eyes, and the routine use of PPE is an institutional requirement in all healthcare facilities, and it is important for the IP and the healthcare providers to understand the specific technique in which PPE is put on and taken off. So, there are the three categories of PPE. First, the gloves. Second, the gowns and the facial protection, example the surgical masks or respirators. So the next is the sharp safety and prevention of bloodborne pathogens. So the another critical element to consider for both standard and transmission based precaution is sharp safety and the prevention of bloodborne pathogens. Next, or the last one, is the visitor management. So, visitor management is the control of both access and action of people visiting patients or residents for the safety, security, and prevention of disease transmission. And it is also important topic for review and consideration in terms of the implementation of and compliance with the precautions. Now let's move on to the transmission-based precautions. The transmission-based precaution, standard precaution when applied correctly and consistently, will decrease the chance of transmitting of the majority of infection. However, there are other situations which will require targeted precaution to protect the patient, healthcare provider, visitors, and the environment. So these additional precautions are known as the transmission-based precaution. And these transmission-based precautions include the contact precautions, droplet precautions, and the last is the airborne precaution. So the contact precautions are prevent the spread of infections agents by direct and indirect contact. So the key components of contact precaution include the hand hygiene, PPE, patient placement, equipment management, patient transport, and visitor management. And the second is the droplet precautions. So in the droplet precautions are used to interrupt the transmission of infection agents that are spread by the droplet route. So similar to contact precautions, the key components to droplet precaution include the hand hygiene, PPE, patient placement, equipment, patient transportation, and visitor management. So the last is the airborne precautions. Airborne precautions are used to prevent the transmission of infection agents that are spread through the air, and this is different than droplet in the size of the particle and the length of time they remain in aerosolized form. So similar to contact and droplet precautions, the key component of airborne precautions also include the hand hygiene, PPE, patient placement, equipment, patient transportation, and the visitor management. So that's all, and thank you for watching and listening.